Hello, my name is Maxwell Hansen, and 4 of my aunts, and maybe someone you know, has been diagnosed with breast cancer. Radiation dermatitis is the most common malignancy associated to breast cancer patients undergoing radiation therapy, occurring in 85 to 95% of patients. It is best characterized by inflammation and other related skin toxicities. Radiation dermatitis is so painful that some patients may even stop seeking treatment because of it. The study done by the Robigens and others group in 2018 found that standard fractionation and photobiomodulation decreased the incidence and severity of radiation dermatitis in post and pre-mastectomy breast cancer patients. A study done by the Arsenault and others group in 2020 found that hypofractionation results in the incidence and severity of radiation dermatitis in post-mastectomy. A 2022 study done by the Robigen and others group analyzed a method used to analyze hypofractionation and photobiomodulation in their use to reduce radiation dermatitis post-mastectomy. Of course, this brings up a gap in research. What treatments are best at reducing radiation dermatitis in both pre- and post-mastectomy patients? For our first two hypotheses, states that standard fractionation will result in lower radiation dermatitis severities than hypofractionation in pre-mastectomy patients regardless of photobiomodulation status. Our last two hypotheses will be that hypofractionation will result in less severe radiation dermatitis severities than standard fractionation in both the group with photobiomodulation as well as in the groups without it. Our goals of this study will be to adapt the Robigens and others 2022 study and 2018 studies in two major ways in order to obtain a larger amount of data. Of course, this brings into account 8 major groups to consider when analyzing radiation dermatitis. Of course, standard and hypofractionated radiation dosages qualify as 2 groups in their own respects, as well as if you're examining if patients are pre- or post-mastectomy, we see that this number must be doubled again. For the application of photobiomodulation therapy, an MLS6 laser will be the laser likely used. This is because it is used in breast cancer radiation dermatitis studies, and it is industry standard. The Halcyon will likely be used for the application of radiation therapy. Intensity modulated radiation therapy device, such as this one, is the one typically used in studies such as this one. The Cyan et others group in 2020 found that standard fractionation without photobiomodulation significantly results in hypofractionation and lower radiation dermatitis severities than hypofractionation. The Robigens and others 2022 study found that hypofractionation, or standard fractionation with the inclusion of with photobiomodulation, significantly reduces the incidence and severity of breast cancer radiation dermatitis. A study done in 2022, done by the Arsenault, in 2020, done by Arsenault and others, as well as Cyan and others in 2020, found that radiation dermatitis is significantly reduced when hypofractionation is utilized post-mastectomy when compared to standard fractionation post-mastectomy. Results such as these would support our third hypothesis. A study done by Robigens and others in their 2022 paper, as well as Cyan and others in their 2020 paper, found that radiation dermatitis will be less severe in hypofractionation and photobiomodulation post-mastectomy. Interestingly, the results are quite controversial due to a 0.3% failure of significance by the Robigens and others 2022 study. While these results may not be supported in the traditional sense by the literature, it is in line with current leading expert opinions. Results such as these would support our fourth and final hypothesis. Treatment guidelines for the prevention of radiation dermatitis in both hypofractionation and standard fractionation will be developed such that standard fractionation should be utilized pre-mastectomy with and without photobiomodulation, and hypofractionation should be utilized post-mastectomy, with and without photobiomodulation. Patients treated with photobiomodulations may have reduced radiation severity when they're against radiation dermatitis severity. The application of this study is quite major, being that it should redefine the standard of what breast cancer care looks like and redefine the standard of what the future of breast cancer care can look like. These are my 4 aunts who have breast cancer, 2 of which have refused to stop seeking treatment because of the malignancies associated with it. This is my Aunt Pam, who died last year on New Year's Day because of those malignancies. The future work of the study will be to analyze the sphingosine kinase 1 gene progression and the TGF-beta 1 gene progression in both hypofractionation and photobiomodulation. Future work also includes researching radiation dermatitis and other fractionations, and researching other fractionations with the inclusion of photobiomodulation therapy in order to outline other ideal patient guidelines. These are my works cited, and thank you for my presentation.